Welcome back, everyone. Health workers across the country are seeing a rise in COVID cases. That's certainly what we've seen. A lot of cases in Houston. I know a lot of people with it right now. Let's find out what's going on with it. We'll bring in infectious disease expert Dr. Yancey from Memorial Hermann, who we've talked to many a year about this now. Welcome. So happy to see you as always.
Oh, good morning.
What are you all seeing and hearing at Memorial Hermann as far as cases of COVID are concerned? Are these ending up in some hospitalizations still these days?
So we're seeing a lot of COVID in the community. Lots of people have cases, but very few of them are requiring hospitalization. These are tending to be mild, self-limited cases that people can handle at home.
Oh, that is huge to hear and so different than in the beginning. Do you feel like it's just because enough people have gotten vaccinated, or that we've all just become a little more immune to it through the years by just getting those germs here and there and everywhere?
It's a combination of both. The vaccines have been huge, but also at this point, almost all of us have been exposed. So we have this great combination of natural immunity and vaccine-granted immunity, which has taken a really deadly disease and really is transforming it into the common cold.
And as it has changed through the years, it seems like we see different symptoms here and there. What are you hearing about right now? What are the most common symptoms people are getting with it?
So this is going to sound very familiar. That loss of the sense of smell tends to be the first thing. And then just upper respiratory congestion, runny nose, a bit of a cough, but very few people are getting pneumonia with it. And that was the big killer in the beginning. So to hear that it's just mostly confining itself to the upper respiratory tract is great news.
Oh yeah, that's what we really want to hear. Now, it seems like for a while, Dr. Yancey, we weren't hearing of that loss of taste of smell so much, right? Has it come back to that full circle?
I'm not sure if it ever really went away so much as we were all just so familiar with it, we stopped talking about it.
Maybe so. That makes sense. So who needs to get to a doctor? If they do the home test, but things are starting to advance, when do you want people to really be on the lookout of, hey, it's time to get help? Even though you're not seeing a lot of hospitalizations, I want to make sure people are ready for that.
Anytime you start getting short of breath, if it gets hard to start breathing, you need to get to a healthcare professional right away. A lot of people still have those home oxygen monitors that we bought a lot of in 2020. If your oxygen saturation is below 90%, you need to go to the emergency room. So shortness of breath, oxygen saturation below 90%, seek medical care.
All right. Dr. Yancey, always good to see you from Memorial Hermann. Thanks for sharing your expertise with us. And I feel like you had a really good, positive update. I didn't know where you were going to go with this, but I feel good after talking to you. I'm sure our viewers do as well.
Oh, thank you so much.
All right. Thanks a whole lot.